Hi, everyone. Michelle Seidling here with another episode of Food Experience Unplugged. Today, we're talking about chronic pain, which unfortunately is all too prevalent in our world today. But thankfully, we have with us Dr. Mitchell Yass, who can tell us all about chronic pain, maybe how to get rid of it, and a whole lot more. Welcome to the show, Mitchell. This podcast is available on multiple platforms, including YouTube, Apple Podcasts, Spotify, and others. Please be sure to subscribe on your favorite podcast platform to be informed as new episodes become available. If you enjoyed today's episode or any of our episodes, please rate and review the podcast on your favorite platform. As always, check out our website at foodexperienceunplugged.com for some resources as you begin your health journey.
Thanks for having me, Michelle. Happy to be with you.
Oh, happy to have you here. Unfortunately, we have to have this episode about chronic pain, but thankfully, you've done a lot of research and so forth. But first, will you take a moment to introduce yourself and what brought you to this point in your life and career? Why the direction of chronic pain?
So, if you look at my actual full life's experience, it seems like it has been a path from childhood that has drawn me to this time and this place. To start, I was the 99-pound weakling, the guy who had sand kicked in his face, real self-esteem issues. And that led me to recognize the only thing that was going to change my life was putting muscle mass on. I would definitely figured I could feel better about myself if I put muscle mass on. So from 19 to 26, I tried to lift weights the old-fashioned way, Joe Weider, Arnold Schwarzenegger magazines, and nothing took. And then suddenly it came to me, I remembered that I had taken a high school physics course. And I realized that weightlifting is really about a gravitational force, which is a force vector, and that relates to physics. So why don't I start applying laws of physics, force vectors, fulcrums, lever arms, and see if that helps to make me understand the best way to push the resistance. And that understanding allowed me to put 40 pounds of muscle on over a 4-year period. I went from 160 to 200 pounds. Just as this point was coming at the completion of the 4 years, I was at the 5th year of my first career, which was a project manager in construction, and I just wasn't feeling fulfilled. I just didn't see the value in continuing there. And I actually had taken a job in a gym, and the first guy I meet says, you can make a living treating people without having to go through the full extent of being a physician. So I said, what type of jobs? And he said, well, there's physical therapy, occupational therapy, exercise physiology. And this was literally the first time I'd ever heard the phrase physical therapy. So I looked into it and it sounded like a good career. I already had a bachelor's of building construction, so I only needed 6 prerequisites. So I took that, applied, got into physical therapy school. During the process of being there, the stuff you're learning for a guy who was taught logical thinking as a child just wasn't making sense, primarily when it came to the issue of how to diagnose pain. Primarily, the use of the MRI is the globally accepted way. So you have pain, you find a herniated disc or stenosis, let's say in the lower back, because it is found for the first time at the time of the pain, it is asserted to be the cause of the pain. This is called correlative theory, junk science. It's actually not an accepted concept of logic or science in terms of establishing cause. It promotes correlation. So as I get into the second portion of the education, that's where we're going to treat people. And so as I start to treat people, to me, the most logical question I had the very first time I'm meeting somebody is, where's your pain? And so they would describe and point to exactly where their pain is. And the most shocking thing became evident to me. Where they were complaining of their pain was not where you would expect it to be if the identified structural abnormality on the MRI were to create pain. So if it's not where it should be, based on the structural abnormality creating pain, then the structural abnormality can't be creating that pain, which is stunning as I'm finding this in almost every person I'm treating. And it led me to this horrible moral conflict. Do I follow what I was taught and educated to do? Or do I go on this crazy brand new path of saying, you know what? Try to interpret the symptoms and see if you can figure out what the tissue is creating it. And of course, at 32, with a massive background in logic, I said, I think I can do that. So I did that. And what I found, and this is the stunning part of the discussion, is that in more than 98% of people I've treated, the tissue in distress eliciting their symptoms is muscle. Muscle causes do not show up on diagnostic tests, and there is no medical specialty educated or trained to identify them, which leads you to the understanding if that is the cause and it's not identified and treated, it will continue to elicit your symptoms, ergo, chronic pain.
Wow, that is quite a journey, and thankfully you like to go off the beaten path, so to speak, and be able to really come to conclusions about chronic pain and how to diagnose it and so forth. Now, a big question I have is the MRI is the acceptable way to identify pain. Why is it that it has become that? And then what is lacking in the MRI that is that your method and research has really been able to take off in a different solution?
So there's a bunch of things you have to try to understand. First of all, nobody knows what the real reason the MRI was created for. It was not created to identify the cause of pain. It was created to identify tumors in the brain. That's what the MRI actually was created for. How it shifted to now being the so-called gold standard for identifying the cause of pain, that's something that you need a real investigation about. That there's clearly some financial situation that had a secondary usage allowed for this to be used in this manner. Okay. So that's the first thing you want to try to understand. Secondly, if you want to understand the cause of chronic pain, then you have to understand it from a historic purpose, right? A historical presentation. Well, nobody understands this or knows this, but chronic pain never existed in the history of mankind. Never existed. Never until the late 1980s, early 1990s. So the question then becomes, well, so what brought on chronic pain? And the answer is the same exact thing that has been proven and accepted to be the cause of type 2 diabetes, cardiovascular disease, and obesity. And that is the advent of technology, automation, the use of telephones and laptops, and all these types of things, which have led people globally to stop using their bodies and doing manual types of activities, which has led to weakening of muscles, which then make them more susceptible to straining when you do try to do an activity, right? So if you look at the population prior to the late 1980s who suffered with pain, if you will, well, that was the geriatric population who had retired. There was no other group who had widespread chronic pain. Right? So why them? Well, they retired. They stopped being active. Remember, they sit on the porch and rock, right? The classic concept. Well, that led them to be more susceptible to straining their muscles when they tried to use them. Well, now you're talking about the population suffering with pain going from the 60s to 90s all the way down to the 20s. I've had examples of 20-year-olds who said they felt like they had bobbleheads, that they couldn't support the weight of their head. They're 20. But that's because they sit in front of a laptop and stare at YouTube and Facebook and everything else. And it's led to an improper posture, which had muscles working in a way they shouldn't. They didn't condition themselves for it. So they strained and elicited pain. So the reason for widespread pain was the advent of technology leading to a massive age population not using their muscles in the way that they should. So why chronic pain? Well, the advent of technology also led to the advent of the MRI, and the MRI doesn't show up muscular causes. There are 4 primary causes, muscular causes. A muscle can strain and cause other muscles to compensate and elicit pain. Muscles can cause misalignment of joint surfaces, and the joints rub in a way, the surfaces rub in a way they shouldn't. That's why people have knee pain around the kneecap. There's nothing structurally wrong. The pain isn't being elicited by any structure of the joint. It's coming from muscular weakness or imbalance causing your kneecap to rub in the way it shouldn't. If I resolve the muscular deficit, I can make your kneecap track properly and you have, no pain and fully functional, even if a meniscal tear was found or arthritis. It's independent, right? Another one is muscles refer symptoms. So the person who wakes up when their hand is numb because they laid on their shoulder, they'll be told, well, an MRI found a herniated disc. It's not from that. It's your rotator cuff muscle that's strained. Your shoulder rolled forward when you were laying on it because it wasn't held in the proper position. That overstretched your rotator cuff, and the rotator cuff referred symptoms to your hand. And finally, muscles can strain and impinge on nerves, which is the actual cause of sciatica. Sciatica could never come from the lumbar spine. It is irritation of a nerve, and nerves don't attach to the spine. Nerve roots come out of the spine at different levels, and away from the spine, they form nerves. So irritation of a nerve could never happen at the spine. It just so happens that the sciatic nerve in the gluteal regions, it's very close to a muscle, and it can strain and elicit pain. It can impinge on the nerve, eliciting pain. So those are the primary mechanisms that muscle can elicit pain. And I would say over 29 years, almost 3 decades, 99.9% of the people I've treated, that's what I proved was the cause of their symptom. So everything I just described cannot be found on an MRI, which is somewhat disturbing if you're trying to identify the tissue in distress creating your symptom.
Okay. So now you've developed your own the Yass method. So will you tell, or maybe you described it a little bit in our previous paragraph there, but tell us more about that method and how that differs from traditional research.
So let's say, let's just do something super, super obvious. The person's having neck pain right in the upper trap region, right? You're having pain right here, right? And you have limited motion, and it hurts when you try to sit at the computer or use your arm or any of this stuff, and you keep getting pain here, right? So the typical way you would see care is that you get an MRI and it finds a herniated disc or stenosis or a pinched nerve in the cervical spine. And since that's found at the time you're having the symptom here, it is said to be the cause, simply based on correlative theory. The herniated disc or pinched nerve or stenosis is found at the time of the pain, therefore it is the cause of the pain. Just so everybody knows, the MRI would show that you have 2 elbows at the time of your pain. So therefore I could, with the same exact logic, say 2 elbows is the cause of the pain. You could see how psychotically foolish that is. It doesn't make sense, right? And by the way, if herniated discs cause pain, then you would expect those that don't have pain to have no herniated discs. And by 1994, it showed 70% of the population have bulging or herniated discs that have absolutely no back pain. So everything about the use of this has no theoretical, scientific, or clinical basis. So we can kind of eliminate that concept. But let's go forward in terms of your symptom. So if the disc were to cause the pain, where would you expect to press to bring on this symptom? The symptom that is 4 inches off your spine. You would have to press on the spine, find the disc, press on it, and all of a sudden, you would feel it shoot to this area. Well, you could do that from here to eternity, and you're never going to bring on the symptom, right? So it's showing that your symptom is not referred. Therefore, it couldn't possibly be coming from that disc, even based on the presentation of the symptom. But if I pressed right on the spot, which I've done thousands of times, the person goes through the roof. Yes, oh my God, yes, that's my pain. Don't touch me there again, right? So I pressed here where the pain is. That is known as point tender pain. And point tender pain represents that the tissue I'm pressing on is the tissue creating the pain. So I pressed here, pressed on your levator scapula muscle. You had pain, therefore, on the first pass through of examining your symptoms through what is called palpation or touching, I just proved that the tissue I'm pressing on is the levator scapula, and that brings on your pain. Okay, so that tells me right off the bat, it wasn't from the identified disc. It was from the muscle. Now, you have to understand, levator scapula, elevate the shoulder blade. So although this appears to be in the neck region, it actually is a shoulder muscle. It actually helps to stabilize the shoulder blade. Well, if you recognize that, you'd recognize you probably would find other muscles involved in shoulder function to have strained, causing this to overwork, break down, and elicit a pain. So I would then do muscle testing. Look at your posture. Maybe along with that being painful, I might find that that person presents with the shoulder elevated on that side. And people will say, well, so what? What is it? Well, posture is the culmination of the pulls of muscles. So if a muscle were to strain enough to elicit a pain, isn't it possible it would lead to an improper posture? Yes, they go together. So another number 2 indicator of symptoms showing that it's a muscle, not a disc, is an elevated shoulder. Then I muscle tested and found there are many muscles on this side weaker than this side. Another corroborating indication, muscles weaker, right? So you go through this process, and I could give you a narrative from the Yass method, which says that you strain the levator scapula because the infraspinatus, a rotator cuff muscle, and the muscles between the shoulder blades are strained, causing you to have dysfunction of the shoulder, leading to the levator scapula straining. So the answer to that, how do you treat that, is not an epidural nerve block. It's not surgery. It's not traction. It's nothing to the cervical spine, because I've just shown you it's shoulder dysfunction that is leading to the muscle straining. So we would do maybe a little massage, a little stretching of particular muscles. And then I'm going to do a series of exercises to isolate the muscles that are weak in shoulder function, cause them to adapt to greater resistances until their force outputs are greater than the force requirement of me using my shoulder for activity. And I would find myself pain-free and fully functional. And let's be really clear. When I say pain-free and fully functional, I'm not talking about 10% better pain. It's a little better today, but then it comes back. I'm talking about you don't ever have pain again. And as long as you sustain your exercise, you do any activity you want without symptom. That's what we're looking to achieve for the individual. So that is a very good example of how the Yass method works in comparison to the use of the MRI.
Wow, I love it. I love how you just drill down to the cause. Where is it versus trying to read or interpret an MRI or other reading. That's fantastic.
It's very important to understand. Are symptoms real? Are symptoms real? Aren't symptoms the body's attempt to make you aware of what tissue's in distress? That tissue itself that's creating your symptoms, right? So symptoms are real. An image interpreted by an individual is not real. That's a picture. And just realize MRIs are not 100% accurate. You could get 10 MRIs and they'll show 10 different things. You could get, and this has been shown by study, which is super scary. You could have the same MRI interpreted by 10 different practitioners and get 10 different results. That's how scary this is. This is true. There's studies that have shown this. So that's not real. What's real is what your body is showing you and telling you, and you can feel. So if you want to establish cause, you need an interpreter to talk and look at the individual and try to understand what their bodies are telling. And if you do that, you are going to find yourself extremely accurate in understanding what tissue is creating that symptom. And when you're in a position over 3 decades of recognizing that the high probability is that it's muscle, well, now you have an advantage to find all these muscular deficits.
Sure. And then you're getting to the cause more promptly rather than you've got weeks before you can get in for an MRI, weeks to interpret it. You're in a session essentially with you just going through and isolating the cause of the pain.
Absolutely. So basically the way it works with me, whether it's an in-person session or a Zoom session, I kind of don't end that session until there is a massive, if not complete, resolution of that symptom in the first session.
Wow.
That's what I'm looking for. This is not like anything else anyone is. So I have a doctorate in physical therapy. So people say, so what's different about what you do now? Aren't you just doing physical therapy? Well, let's be clear. What is physical therapy? First off, go to the American Physical Therapy Association website and they'll tell you that there are palliative care. Palliative care means nothing more than minimizing symptoms. That's the American College of Physical Therapy. I didn't say it, they said it. That means it's no different than acupuncture, massage, any of these types of things that are simply done. It's a treatment with the intent of minimizing a symptom. It is not established to identify the cause. Next, for physical therapy, certainly in the United States, the vast, vast majority of it is done through getting a prescription from a referring physician. And on that prescription, there will be a diagnosis needed to perform physical therapy. Where was that diagnosis derived? The MRI. So the MRI, you're going to physical therapy with a diagnosed structural abnormality found on an MRI, herniated disc, stenosis, pinched nerve, meniscal tear, arthritis, compression fracture, any of this stuff. And then you're going for physical therapy for them to treat that structural variation. Well, if you had a herniated disc or you had a meniscal tear, what was physical therapy going to do to unherniate or unmeniscal tear the meniscal tear? Nothing. Right? You need surgery for that, right? So if that is the diagnosis, then what is physical therapy? Well, we'll give you some ultrasound, some electric stimulation, maybe we'll do traction. So you had this levator scapula as the strain, which relates to your shoulder. And you're diagnosed with stenosis, you go to physical therapy, they're going to do traction for your neck, ultrasound for you. They're going to treat you for the disc, right? So how does that resolve the muscular deficit? It doesn't. And by the way, unless someone wants to show me weightlifting 101 in the curriculum of a doctoral level physical therapy, I don't know where the weightlifting portion comes, where you have to know how to isolate individual muscles and cause them to adapt to progressive resistances to get their force output greater than the force requirement of activities. I figured that out through the application of physics on myself. which I have been lifting weights for 36 years, put 60 pounds of muscle on, and have treated multiple thousands of people over 3 decades utilizing this method. So when I say it's my method, I think it should be evident that this was personally driven and personally derived.
I love that. To just really your focus on getting to a solution and really eliminating the chronic pain. Now, will you tell us a little bit more about this strength training that you focus on for a solution to the chronic pain?
Excellent. Good question. So let's just make a point. One more. I want to make one more point about. So I'm saying that in 98% of cases, if not greater, the cause is muscular, and everyone is being told by the orthopedist, neurologist, no, it's a disc, it's a disc, it's a stenosis. Okay. So I have one question for the individual. 2 questions. Number one, is your pain continuous? Literally 24 hours a day, 7 days a week, you have that same exact pain at the same intensity. And everyone's going to say no. Then I don't understand. If arthritis is causing your pain, and arthritis is a process that is continuous, if arthritis causes pain and the process is continuous, wouldn't you have continuous pain? I would say yes, right? By logic. This is a logical argument, not a medical argument. If you have stenosis, which is narrowing of the vertebrae impinging on a nerve root, isn't that always narrowed? So wouldn't stenosis always continuously cause a symptom? I would think so, right? Because you don't, at times, unstenosis and then stenosis and then unstenosis and then stenosis, right? So if someone's willing to say a structural cause or a structural abnormality is the cause, you would expect your symptoms to be continuous. But nobody has that. People have symptom intensification when they do activity. So if I said to the person, is there any type of activity you do that seems to lead to increasing or the initiation of your symptom, and you say yes, you just identified your problem's muscular. You just said it. Because it is not your kidney, it is not your liver, it is not your spleen that's allowing you to do that activity. It is muscle. And of course, you're going to be concerned or question the fact that I'm telling you that because nobody prior has ever said it's muscle. Because muscle can't show up on diagnostic tests, and there is no medical specialty educated or trained. So I dig the fact this is new. I dig the fact that I'm the only guy saying this, but don't accept something based on some person saying it. Accept things when they make sense to you and they're logical. I hold myself to the same level of proof that I expect anyone in any field to hold. You don't do it. If Dr. Oz said, oh, the Yass Method is the answer, I don't expect you to run and say, I'm going to do it now. Dr. Oz said so. I want you to do this because Dr. Oz said that. Then you went on and you went on my YouTube channel, or you bought my book, or you went to my Facebook page, or you contacted me. And I proved to you that the physical presentation of your symptoms indicates that, in fact, your problem is muscular, which then leads us to the question at hand, which is how do we do the strength training to allow us to resolve that? So I really want that to be made clear to people. Now, in terms of the strengthening, here's what's different. So I'm going to establish, go back to here, the levator scapula has strained because there's a muscle in the back, mid-back area called the lower trapezius muscle, and it pulls the shoulder blade down. So if that doesn't work properly, well, that can cause the shoulder to rise, and that can cause this to shorten and strain. So I would want to try to isolate, let's say, one muscle, the lower trap. So you have to know the actual mechanism that that muscle does in terms of creating motion at a joint. So if you understand that, now you know how to strengthen that muscle. Now you have to know how to apply resistance to the muscle so that as the muscle adapts to progressively increasing resistances, it adapts by getting stronger and making more muscle mass. So for every muscle that exists on your body that's related to function, you have to understand how to do the isolated strength training exercise for every one of those muscles. And you want to understand that each muscle moves one joint in one direction. Every muscle moves one joint in one direction. So if someone's having you do exercises and you're doing some kind of dance or some kind of twisting or multiple joints moving or one joint moving in multiple directions, you are not doing isolated strength training. Therefore, there's no possible way you could be isolating the particular muscles that are responsible for your symptoms. So you have to know how to isolate each muscle, how to cause them to adapt to greater and greater resistances. That is the only way to get all the muscles required for normal function to occur to have a greater force output than the force requirement of your activity. And that's the only way to become fully pain-free and fully functional. And just again, and I don't want to beat a dead horse here, but I kind of got the chance to understand the laws of physics for strength. And in a joking fashion, if you really want to know who I am, just imagine Arnold Schwarzenegger and Albert Einstein got together in some perverse way and had a child. That's me. That's where my education comes from. A personal understanding of how to do weightlifting, and then applying the laws of physics to it. And that's what I use with the individuals that I treat. And the results are just astronomical. Astronomical. There's a almost religious connotation that happens. Maybe that person's had pain for 10 years. I treated a lot of suicidal people who literally walked in my door and said, I'm putting a bullet in my head. If you do not resolve my pain, you are my last resort. I've tried everything else. I cannot live as sick as this sounds, I can't live another day on earth like this. And that is the kind of thing that's very sobering. It makes you focus. It becomes every thought in your brain until you're able to make that person's symptom go away, which has driven me to want to know everything there is to know about this kind of thing. And so that's what's led me to really want to perfect this understanding and to get these exercises to work as effectively as they can. And to understand the types of population, I've worked from people as young as 5 and as old as 102, from the most sedentary person to the highest level athlete. And the mechanisms for these exercises are the same. That is what, it doesn't matter if you're a man, doesn't matter if you're a woman. There are no women exercises. There are no old age exercises. There's no sedentary exercises. There's no high level fitness exercises. When you want to strengthen a muscle, if I want to strengthen my bicep, or you want to strengthen your bicep, or a 100-year-old lady wants to strengthen their bicep, you just do elbow flexion. That's what the muscle does. It's just a question of what's the appropriate resistance. And that's kind of, an important thing to understand.
Wow, yes, just the gamut of age range, circumstances. So it's not necessarily a sedentary illness or a sedentary
No,
problem.
because that's another really good point for people to understand. There are very active people who end up with knee pain or shoulder, and they're like, I don't understand. I'm doing what everyone said, be active, and I'm still having pain. Understand the principle that if there's a muscular deficit, there are 2 forces that kind of determine functionality in life. You live in a gravitational environment. You live on Earth. So there's always a force pushing down on you, right? 24 hours a day, 7 days a week, you always have this force pushing down on you. So if you want to do anything other than lay completely flat on the floor, you're going to have to fight gravity, right? What's the purpose of muscle? The purpose of muscle is to allow you to fight gravity to perform function so you can eat. So if we were caveman, right, or cavewoman, we needed to kill animals to eat. We needed to have shelter to sleep. We needed to be able to travel long distances when weather came. Well, that was all about function. And basically, you died if you weren't strong enough. There was the true essence of survival of the fittest. So we know that muscle's purpose is to allow us to function. And the thing attempting to impede that is gravity. So you have gravitational force pushing down on you, which is basically what I talk about when I talk about the force requirement of an activity, whether you're typing, whether you're lifting something, whether you're standing. What is the force requirement necessary to allow you to do that activity? That's one. And then there's the force output of the muscle. So the force requirement is down. The force output is up, right? Your muscle is pushing up. So if the force output is less than the force requirement, the muscle is going to strain and elicit pain. Strengthen the muscle using progressive resistance until its force output is greater than the force requirement, and you're pain-free and fully functional. It literally is that. If someone wants to understand what is the essence of the Yass method, it is the understanding that there are 2 forces, force requirement versus force output of muscle, and that to be pain-free and fully functional, you need to have a greater force output than force requirement. If force requirement is greater than force output, you will have symptom and be dysfunctional. That's it. Fix it.
Mm.
That's the concept.
I love it. Now, one other question too. Now, you go through the diagnosis and the strength training exercises. What about maintenance? Like once they're healed, okay, I don't have any more chronic pain. Then what to prevent or at least minimize the chance of recurring chronic pain?
Great question. I want to hit one other point about this concept of me doing strength training. So they're going to people who are going to hear this and they're going to say, I understand. I can't stand because I have knee pain. I can't go upstairs because I have knee pain. I can't kneel. What the hell are you talking about that I'm going to do strength training without pain? How could that possibly be possible? Here's what you want to understand. Why is your pain happening with standing, with kneeling, or with stair climbing? Because those are activities, and activities take groups of muscles to perform them. If there is a weakened muscle, other muscles have to compensate to take that load. That excess compensation, that excess load that those muscles have to pick up are forces it wasn't designed to take. So it leads muscles to strain, eliciting pain. I just mentioned that Yass Method strength training exercises are exercises where you're moving one joint in one direction, only causing one muscle to contract. And in fact, the majority of it is done in a seated position, so you're fully stable. That allows the fourth requirement for that one muscle doing the exercise, which is the resistance. We could certainly measure the appropriate resistance, right? If you try to do the resistance and you have pain moving that one joint one direction, well, obviously it's too much resistance, right? So I find a resistance that's appropriate to cause the muscle to contract, but because you're only moving one joint one direction to do the exercise, there's no capacity or no opportunity for compensation. So we have tremendous control over strengthening these exercises without ever creating pain. And the weird part that happens with people, they'll kind of stumble in or they'll limp in, and I'll do some massage and stretch and do some exercise. But remember, during this process, they probably never gotten off the table or never had the chance to walk again. And then they suddenly stand up and I say, okay, see how it feels now. And they are pain free and walk perfectly. And they're like, I don't understand. How did you just do that? Because during the process between when you first lived in and now are walking without any symptom or kneeling or going upstairs, I isolated the individual muscles that were responsible for that, got their force outputs to a level that would allow them, the joints, to function properly and allow you to function properly so that you were asymptomatic. So that's an important delineation about Yass Method exercise versus other things that are going on. Yass Method exercises are all one joint moving in one direction. Most is done in seated position, and there will be a rare combination, such as a squat or a lunge or a straight leg deadlift, but that's not until the individual muscles that would be required for even those type of more complex exercises are strong enough. And that's why no one has pain when they do my exercises. So now going on to your next question. So now, ta-da, you're pain-free and fully functional. You come to me for 1, 2, or 3 treatments. Oh my God, this is incredible. What now? Just remember the Yass law of living pain-free, which is if the force requirement is greater than the force output, you're going to have symptom. So if you're pain-free now walking, I would suggest you sustain the same level of strength by sustaining the exercise. Then you might only have to do it 2 times a week, but you don't have to progress the resistance any farther, because we know at that resistance level and that strength, your muscles are strong enough. So all you have to do would be a maintenance program of say twice a week, just sustaining your resistance. And at the functional level you're at now, you'll be asymptomatic and fully functional. But the average person who now, after maybe, and this is serious, after a year, 2, 5, 10 years of being miserable and having a terrible life, might say, you know what? Screw walking. I've been dying to play golf, or I've been dying to play tennis, and now I'm pain free. Here's my chance. The Yass method doesn't work. What they neglected to understand is that in doing this new activity with a much higher force requirement, you kind of needed to increase your force outputs, which meant that if you were to do that, you're going to have to progress the resistances again until the force output of those muscles is available for this newer, higher level of function. And so that's the concept of maintenance. Maintenance is, as long as you're doing activity and you're asymptomatic, you have to assume you have the strength for it. If you start to do another activity of a higher level, then you're going to have to assume you're going to have to do more strengthening to get your force outputs up to that. Now, one point I want to make about during the process of doing the Yass method, nobody strengthens more than 3 times a week. Here's a little ditty for people to understand about that strength training I'm asking you to do, which is that when you're doing the exercise, you are not making muscle. You are creating micro tears in the muscle, which is what leads to an inflammatory response, which then causes the muscle or the body to recognize the inflammatory experience has occurred, and it brings proteins and causes muscles to grow. That inflammatory response occurs over the next 24 to 48 hours after the bout of exercise. So you don't ever want to strengthen during the inflammatory response, the muscle's going to strain. So Yass method exercises are never performed more than 3 times a week: Monday, Wednesday, Friday, or Tuesday, Thursday, Saturday. There are people out there and they're doing physical therapy and other types of treatments, and they're being told they need to do it 5 or 7 days a week. By definition, you couldn't possibly be doing strength training. Because I assure you, if you ever did a real bout of the exercise that I want you to do, and over a period of time, you start doing that back to back days, you're going to find your pain's going to be increasing and you're going to have greater dysfunction because you're actually hurting your muscles. So unless you are taking time, if you're doing real strength training, causing muscles to create micro tears to grow more muscle, you're going to have to take at least a day after that to heal and allow the muscle to rest. So during the process, 3 times a week. Once you've achieved the level of functioning you're happy, you could easily go back to twice a week, and that's fine. And I think that'll work. And by the way, the number of muscles typically work during the Yass method process is, I found over almost 3 decades, no more than 3 to 4 muscles responsible for function. So going to physical therapy and getting a page of 15 exercises probably is not going to isolate the individual muscles that are required for you to strengthen to achieve your dysfunction. Over almost 3 decades, that's 3 to 4. That's all it takes.
Okay. So now, where do people start, regardless of their age, regardless of their circumstance? Hey, I've got chronic pain. Where do we start?
So I hate to tell you, I know everyone wants to try to fix themselves, and I'm good with that, but you at least need an evaluation. You have to get the evaluation. The evaluation consists of a history. You have to have a history, a kind of quick, cool story about a guy I just treated last week. The guy's had pain in his knee, couldn't straighten his left knee, had Achilles tendon pain, and had his opposite lower back muscle bothering him. 3 locations, and he's had this for multiple years. So I looked at his knee, and he said he couldn't bend it, and I was like, try to push your knees back. Show me what that looks like. And sure enough, he could not bend that left knee. So obviously the question has to be, did like something happen to your knee, or why can't you? And the history indicated, oh, you had surgery 15 years ago for what you were told was a meniscal tear. Well, guess what? You never fully got your strength back of your front thigh muscle, which is responsible for straightening the knee. And when I asked him to pull his shorts up so I could see his quad, you could see that that left quad was a third smaller than the right. So this guy's primary cause of this symptoms, I'm not even discussing the surgery, but it was the inability to regain all his quad strength, which eventually led him to impede him from fully straightening that knee, which led to all these other areas. So we did the appropriate exercise, and he came out and he's like pretty much pain-free like a week later, right? And that's after this 15-year process occurring. So you got to get a history. You might have lower back pain, and all of a sudden on the left side, you're going to tell me 3 years ago, I broke my right ankle. And it's perfect. I don't have any pain now. I have no pain at the right ankle. I just have it at the left lower back. Well, that's important to know, because then I'm going to ask you to single leg stand on the left and single leg stand on the right. And I'm going to find out you can't single leg stand on the right because you never regained your strength on that side. And all you've been doing is compensating by weight bearing fully on the left side, which caused the left lower back muscle to strain. So the cause of the pain in the left lower back was a weakness in the right leg because you never recovered from that fracture. So it would have been very important to know that that person fractured that ankle. So you got to get a history to understand sequentially how these things are occurring. Then you need a physical evaluation. I've got to see, are there postural variations? Are there movement patterns? If there could be a muscle test, a palpation, any of these things to help really dial down to which are the muscles, if in fact it's proven to be muscular, which it is in more than 98% of the cases, which muscles are responsible. Then you kind of need to know how to do the isolated strength training. how to use progressive resistance, and that's the basis for the treatment. Once you get to that point, the faster you can understand how to follow that process, the faster you don't need treatment anymore. You just need time and effort. And that's what's very funny about the Yass method. So every other method is having you stay longer and longer and longer and longer with them. The Yass method is a reducing process by which, if you could figure this out and you're pain free after a treatment, God bless. It cost you all of one treatment and you're pain free and fully functional. If not, the goal is to get you to understand what you need to do, understand what the cause is, understand how to resolve it in the shortest period of time. I'm trying to get rid of people, not keep them for longer. That's why this is so unique.
I love it. Well, well, Mitchell, how can people get in contact with you?
So if people want to get in contact with me, the most easy way is through email at drmitch@mitchellyass.com. Or you could go on my website, which is live without pains, plural, livewithoutpains.com. There's a contact us button if you want to contact me that way. But if you suddenly, maybe you've heard this and you're like, oh my God, I've never heard of anything like this before. This sounds like something for me. If you want, you can, you're not in the Jacksonville, Florida area, you can actually go on the website and schedule a Yass Method Zoom session for yourself. Pick a day and time that's most comfortable for you. And again, you could do that at livewithoutpains.com, and you just put /sessions, and that's how you schedule. I think that's the best way. If you want to just learn more information about the Yass method, I personally think the easiest way, go to YouTube, search Dr. Mitchell Yass, go to my channel. I think I'm approaching 250 videos at this point. Pick a body part, and trust me, I've done some video about it. Pick inflammation, pick arthritis, pick any disease entity. I probably have talked about it. And learn, and it's free content. It doesn't cost anything. Take responsibility for yourself. Start making sense of things, and don't accept something just because someone told you. I really don't care what their degree is. I really don't care how famous they are. If you want to be successful at resolving your symptoms, you have to take control. The average person who comes to see me, let me tell you something. I will always say this. These are the most courageous people you will find. And the reason is because when they're having pain at their knee, their hip, their back, or their neck, every one of their friends and family is saying, get the surgery, right? The doctor's telling them, get the surgery. And the reason is because that is the cultural predisposition. It is culturally accepted that this is correct. And yet, when you look at the evidence, theoretically, clinically, and scientifically, it is baseless. And just remember, how many people in the United States are suffering from chronic pain? That's 130 million. How many people are suffering worldwide? That's 1 billion. You've had 40 years since the advent of the MRI and treatment based on it, and the number of people suffering has never gone down. You have to start asking yourself, why? Are people just bad healers? All those people, they just bad. Perfect diagnosis, perfect treatment, they just didn't respond. Does anyone actually think that that's the case? Or is it more likely there's something systemically wrong in how the system is working? You have to say that to yourself. And if the answer is you think it's systemic, you're going to have to break away. And I offer you this opportunity. My proposition, more than for almost all people, you do not have a medical problem. You have a fitness-based problem. So you need a fitness-based solution, which is strength training, and that's what the Yass Method offers.
Fantastic. Well, Mitchell, it's been a pleasure having you on the show today. We will include all of those things in the show notes so people can get in contact with you and begin the pain-free journey. And thank you so much for being here today.
Thanks for having me, Michelle. I always appreciate the opportunity to spread the gospel and let people know there is a path. Don't be disheartened. It's not as complex as everyone makes it out to be. In most cases, it's fairly easy once you know how to diagnose and treat the cause of your pain. So believe there's an answer for yourself. Keep reaching.
Hey everyone, Michelle Seidling here at Food Experience Unplugged. Are you enjoying the Food Experience Unplugged podcast and are ready to ramp it up a level? Then it's time to go premium. With a premium podcast membership, in addition to all the great podcast episodes you know and love, you'll receive additional bonus content and exclusive interviews from many of our podcast guests. You'll receive a live Q&A access each month where I'll address questions pertaining to holistic health and how you can start your journey. You'll also receive weekly shorter video clips with information on tips, tricks, and strategies to get started, to build consistent habits, and to take charge of your health. Go premium today. I'll see you there.